Hello everybody and welcome in. I wanted to show everybody briefly how to use the OB Superbill. So when you're in a pregnancy chart um, and you are on this screen right here and you go to the billing screen. So billing screen is the appointment. Not terribly intuitive, but you get there, it takes you to the billing screen where you put in assessment and your visit code. The S right here is called a Superbill, and we've built some OB Superbills that make billing for pregnancy and ICD-10 a whole lot easier. We've shown this a little bit at provider meeting around, but so let me kind of peruse it for you. So if we click on Superbill, it opens up this looking screen right here, and mine defaults, and I can show you how to set it up. Mine defaults to pregnancy complicated or pregnancy uncomplicated. There are numerous Superbills created that we've used in the past, but this is probably the most powerful that I like to use. So right here you have pregnancy complicated or uncomplicated. Again, under here, under complicated. First of all, the first thing you do is you want to put in an OB visit, which is the 59420. And then it kind of breaks down different complications of pregnancy by trimester, you'll notice. So you have acute problems that kind of rose to the top. So if you're dealing with an acute complaint during pregnancy, you can use one of those. Potentially we should reorder that, but because that's not your run-of-the-mill visit. But from there you have social problems in pregnancy, which a lot of our patients you could technically classify are having social problems just based on their socioeconomic status, their language abilities. So I frequently use this code for kind of a fairly physically healthy patient but has social challenges. There's supervision of high-risk pregnancy due to social problems in first trimester, second trimester, and third trimester. So I use this code a lot, so I'll hit 59420 and then go to that. And this is going to help you get much more specific with your OB billing. We are still seeing people putting in very generic OB codes. We're trying to get better at using more granular OB codes so that we can be better at that, and eventually, potentially, it changes payment down the road. A lot of different reasons to do this. But hopefully this OB Superbill helps it be easy. Next one down is obesity and pregnancy. Obviously something you can code very frequently. I use this one all the time as well. First trimester, second trimester, third trimester. And then you have GDM, managed with insulin, managed with medication, or diet controlled. So you can use either one of those three. Then you have AMA. You have, again, by trimester, first, second, and third trimester for AMA. Insufficient care. So this is somebody who kind of shows up a little bit later, late to establish care for their pregnancy. You can choose them by trimester, first trimester, second trimester, third trimester, obviously. And then back up here you have PIH coding by trimester, elevated blood pressure affecting pregnancy by trimester, and then pre-existing diabetes. So not something that most of you are going to be billing, but our higher risk folks are going to be using that code quite often. History of preterm, again, higher risk folks, some of you are still seeing those as well, but there it is, first trimester, second trimester, third trimester with any history of preterm. Substance abuse, we put that one in there as well, first, second, and third trimester, any drug use. Substance use. History of C-section, again, very commonly used code. Desires VBAC, or this one is just history of cesarean, currently pregnant. Use those ones all the time. Next would be twins, and then chronic hypertension. So you have your pre-existing hypertension, essential hypertension, first, second, and third trimester. So that's your kind of our most commonly coded pregnancy-related complications within Superbill. So you click on the check here, and then you click on the checkbox that you want here, and you say save, and now I've coded by trimester on a specific problem. You do have to link them, which takes a couple of clicks, but you're probably fairly used to doing that. And you're done. And now one thing we've also done with that is you actually have access to, you should have access to the prenatal order set. Most of them are linked. Apparently this one is not. So from here, I click on order sets, and I should pull up some order sets, but it's not. We'll get to get those linked. But once they get linked, you have access to the Star CC prenatal order set, in which you can go through and order things now based on that specific code. Because the challenge is putting in your orders for your OB visit. First, you have to have a diagnosis, obviously. And the most tempting thing to do is to pick the most generic run-of-the-mill diagnosis so you can put your orders in. But going from the Superbill first and then going straight to the OB Superbill, going to the Superbill, putting in your diagnosis, and then going to the OB order set, then you can actually put those orders in pretty efficiently as well. So from here, that's kind of the OB Superbill. The other Superbill that is available, again, from your linear navigation screen on your inside your chart here, again, OB Superbill, it's the S. There's two of them. So there's pregnancy complicated and there's pregnancy uncomplicated. And the uncomplicated just has an OB visit. And then one kind of pro with pregnancy coding is that you it's recommended we try to get savvy with what number of pregnancy it is. So this helps you with that. So if it's their first pregnancy and it's uncomplicated thus far, you can use this one. So you have first trimester, second trimester, third trimester, first pregnancy. If it's the second plus pregnancy, again, first, second, and third trimester, put in your OB visit, put in those things, and you're cooking with gas. So those are the OB super bills. They are modifiable. We can build them, grow them, pare them down. Taking suggestions always. Next step is to get those linked to the OB order set, which it was previously, and need to get that relinked. But that's a quicker way to do your OB billing, and wanted to make sure folks were aware of that. Let me show you briefly how to make those your default orders, your default super bills. May take me a sec to peruse this. So File, Settings, My Settings. And I want to say, it's right here under default, right here, default super bill. If you put the star prenatal complicated, then it takes that to the top of your list, and star prenatal uncomplicated becomes number 2. So I like having star prenatal complicated as my default OB super bill. So set that up, and hopefully be off to the races with some faster pregnancy coding. And thanks for watching.